And coming to this, President Cyril Ramaphosa has announced that lockdown level 4 has been extended for another 2 weeks. Now, this is due to the spike in infection caused by the Delta variant. Let's get some reaction now on this. Medical expert from the Progressive Health Forum, Dr. Aslam Dasoo, joins us now. Doc, thank you for your time and good morning to you. Before I get into your reaction on the overall, address by the President, we just heard now from the SA Liquor Traders Council, obviously not too happy about this, but the President making mention that due to expert medical advice, there was scientific evidence which showed that hospitals were able to rather open up due to this liquor ban continuing to be, implemented, and therefore the sale of alcohol being prohibited. Your take on this?
Good morning. Thank you. Look, I think the research is in, and it does show that prohibition on alcohol sales does reduce the pressure on trauma departments at all hospitals. As you know, all the hospitals are under severe pressure at the moment, so all the beds are required. Now, I understand the liquor industry's difficulty here. There's very little economic room for them to move, and if our system was more expansive and we did have more beds and there wasn't that pressure that leaving alcohol sales open would bring, then I think the industry would have been allowed to trade. But as things stand, our system is completely saturated, and unfortunately there's just no way that we can utilize the beds that we do have for alcohol-related trauma incidents like accidents and so on.
Now, and Doc, with that being said, 200,000, confirmed COVID-19 cases. The President reminding us of more deaths at this particular time during this third wave, but also the fact that the Delta variant seems to be moving quite rapidly to other provinces. How dire is the situation right now across the country? Because Gauteng used to be the epicenter, but we're hearing from the President that it's moving rapidly to other provinces.
Yes, it is, and this is in keeping with the epidemiological trends of this infection. So Gauteng experienced the full impact of Delta, with coastal provinces tending to follow that by about 10 days or so. But what we're seeing now is that even as Gauteng peaks, the other provinces' cases are rising. We've got particular concern about the Western Cape, Limpopo, Free State, Northwest, and we're not sure exactly how high those peaks will go, but they're certainly on the up right now, and this is the Delta variant at play for sure. It's highly transmissible, and it will continue to apply pressure on the entire system. You have to understand that as much as we have cases every day while the wave is peaking, we will continue to have the same number of cases as it declines. And as new cases are identified, there's about a 10-day lag before a large number of them require hospitalization. So it's a snapshot into the future. That's how you have to look at it. So the system will be constrained for at least another 2 to 3 weeks at saturation point.
Yeah, this is a transmissible, highly contagious variant. We've heard that over and over again from medical experts. What do you think is the solution right now? We understand that human behavior needs to continue in terms of masking up, social distancing, being responsible, so not only get sick but get your loved ones sick. But at this stage, from a medical perspective, what solution urgently needs to be, considered here so that this peak does not continue to rampage through the country?
Look, first it needs to be said that there wasn't much room for the President to move in terms of the restrictions and easing restrictions. The way the infection is going right now, all of the prohibitions, especially those on gatherings, must remain in place, because this is a very simple mechanical process. This virus transmits through the air and will have a greater transmission depending on the proximity of people. So that's just a very logical prohibition. We have to stop that. The idea that we can, just see it through this wave is unfortunate, but we have to do that. Now we have two major modalities of protection, and one, of course, you mentioned, the personal protective measures. Those must be diligently implemented. And the second, which should have happened some time ago, is vaccination. Had we been rolling out at this scale months ago, when it was very possible to do that, we would have had an attenuated third wave, even with Delta. So while we do maintain the physical protections and the personal protections and the restrictions in place, the scale of vaccination has to increase now. We're close to 250,000 people a day. That should hit 350,000. There is capacity to do that. And the President assures us that now, for once, vaccine supply is more secure. You know, we're happy with that, but, you know, this pandemic throws curved balls all the time. And we just have to increase the number of vaccines, the number of types of vaccines we use, because it will give us different sources, so that if one breaks down, we still have the others, and the amount of vaccines. So if we can vaccinate at that scale, we can avert a fourth wave, or rather make sure that that fourth wave isn't going to hurt us as much as this one is.
All right, we'll leave it there. Medical expert from the Progressive Health Forum, Dr. Aslam Dasoo, thank you so much for your time this morning.